Okay, hi Karen, I'm Dorothy. I'm the ambulatory clinical educator, and I'll be interviewing you today about your role in the chronic pain clinic. Please introduce yourself and let us know who you are and where you work.
My name is Karen Jessen, and I've been an LPN for about 25 years and have been practicing in the Covington Pain Management Clinic for the last 7 years.
Great, so you work exclusively with chronic pain patients over the last 7 years. Can you describe the challenge that we as healthcare workers face as well as the chronic pain patient?
The challenge is to expand the scope of management to incorporate the complex nature of the chronic pain experience. Rather than trying to remove the pain altogether, which is what the patient wants and expects, our primary goals are focused on improved function, quality of life, and patient autonomy. We focus on effects of pain and the patient's response to pain, addressing the many things in their lives that are contributing to their suffering. We encourage them to get social again, take up a hobby that they might have left behind, to learn mindfulness living, to get active again at a slow, steady pace. They do a lot of goal setting. And for those who need it, mental health, they might use nerve blocks, injections, or acupuncture, and over time with us, they start to focus on things that they can do to help decrease their suffering and learn how to live better with chronic pain. We in the pain clinic see an average of about 7 to 12 patients a day, as opposed to primary care who can see like 20 to 30 patients a day. We take the time needed to hear and validate each patient's pain experience. Sometimes they tell us it's the first time they feel that they've been heard and believed. Quite a contrast to these 10-minute appointments with a primary care provider. They're not listened to, they're handed a prescription of a short-acting narcotic, and many times in the chart they'll be labeled as drug seekers. Just sad.
All right, so you talked about labeling patients and you talked about working with the chronic pain patient. When you first started working with them, what was your perception then and how is it now, and how has it changed over time?
When I first came to the pain clinic, I knew very little about how to treat chronic pain. I was like many nurses and providers, thinking medication really was the only way to alleviate someone's pain when it's in a moderate level like these patients were describing. I found I was judgmental and questioned the patient's sincerity many times, especially when nothing showed up wrong with them. I would check their chart, they'd have negative x-rays, negative lab work. A doctor would say that everything was normal. But over the years, I've learned that as nurses, we really have no right to question a patient's sincerity. They're coming to us for help. When someone says they're in pain, I now believe them. I read providers who write in their charts about a patient's drug-seeking behavior, or I hear, in the grapevine, I hear about doctor shopping and that kind of thing. They have often been to many doctors and have undergone many treatments in hopes of putting an end to their suffering. Many times these prescriptions, these short-acting prescriptions, short-acting narcotics are prescribed for maybe a few months. Then the PCP is uncomfortable continuing to provide that kind of a narcotic, and the patient's told they'll no longer receive any medication and are abruptly cut off. Sometimes without a taper plan, they're just, I can't prescribe that for you anymore. So without being guided to a different approach, they automatically continue on to try and find another provider in hopes to find one that will listen to them and help them. Patients that come to us are dealing with challenging issues. They're deactivated, isolated, and bored. Our motto in the pain clinic is to live better with chronic pain. We want to give them hope, and there's no way that we can remove all pain. We can't remove their pain. It's too complex. But we can help them to live better with it.
Great. Thank you very much, Karen.